what is the cause of cancer. This is a slide where I would like to elaborate why cancer stem cell is produced in the body. Somatic mutations are accumulated only in the cell. Mutator phenotype is a stem cell attribute, and therefore cancer is a stem cell disease. I'll explain the slide very well. I told you the niche of a tissue where the stem cells and niche cells reside. Now, a pointer, I can say you the basal lamina shows where the niche remains in every organ, where there is a niche cell which protects the stem cell to differentiate and create a pool of the cells by either differentiation or by replication. When differentiation takes place, cell divides by a method by which one cell goes into a differentiation, that is heterotypic cell, become a specific tissue for the organ, whether the other cell remains a duplicated cell, which we call as a stem cell. Now, during this somatic differentiation or mutations, if the mutation takes place in the stem cell per se, it will produce a cancer stem cell. Once the cell is differentiated, it cannot become a cancer, because the cell function as a DNA doesn't have a job of creating new type of cells. Heterogeneity is not there. When the heterogeneity is there only with the master cell of the body, which is dividing by either a symmetrical or symmetrical division. A symmetrical division will create a chance of creating a cancer stem cell, not asymmetrical division. Asymmetrical division take the cell towards the differentiation, and once the cell is differentiated, the DNA manipulations are minimum, so the cancer cell production is not there. What is a normal cell and what is a normal cancer stem cell? See, heterogeneity is the basic character of the stem cell. If it is a cancer stem cell, it will keep on producing different type of cancer stem cells. These are the markers which will prove that the cancer stem cell could be there. CD133 and ALDH are the two specific common cancer phenotype cancer markers.
I believe the greatest discovery in cancer was the identification.
This is a video which will speak to you something very specific for the cancer by the global news stem.
So this cell divides 1, 2, 4, 8, 16, etc. And it then differentiates to make a tumor bulk, and that's cancer. The unique thing with the cancer stem cell is it can then leave that bulk tumor to generate a new tumor.
What do you do with the stem cell to try to either prevent or treat the cancer?
NeoStem is the first group in the world to have isolated the tumor-initiating cell from bulk tumors. So during the normal course of care for a cancer patient, if they've unfortunately progressed to stage 4, the last stage before death, they have surgical resection of their tumors. We take a very small bit of that tumor, and for the first time in the world, we are able to extract in purity the cancer-initiating cells. Once we have that, we can then teach the patient's own immune system how to kill them. So we've been able to extract the correct target from the patient. That's extremely important because your cancer is different from mine, it's different from every other person in the world. The name of our treatment is the INTIS study. It's Latin for from within. Teaching your own immune system what to attack is the real key. The uniqueness here is that we have taught it to attack the cancer stem cell, the engine of cancer.
So dear friend, the purpose of showing this video was to make you understand the cancer stem cell is an existing entity. NeoStem is the world's largest company in US, which is the first company to reach to diagnose and detect and isolate cancer stem cells. And how to educate our own immune system to attack these cancer stem cells has been a proven fact today to eradicate the cancer. This is a slide to show you just a therapeutic approach, what conventional therapies are there. Let's go to the few last slides which are very important to speak about the cancer being treated by using stem cells. As I said you time and again, when we go to the slide where I'm going to talk about the stem cells being an application for the cancer therapy, the three best qualities of the cancer are that stem cells can display intrinsic tumorotropic properties. Wherever the single cell, even the cancerous tumor cell is there, the stem cell can attack it. It has got that kind of natural attraction towards the cancer stem cell. Cell can be modified stably to release a lot of anti-cancer drugs. Normally when we talk of chemotherapy, chemotherapy does mean the act on the fast dividing cells, that the cancer cells as well as the normal cells, and we have a lot of complications. Stem cells can act as a delivery vehicle to deliver the specific drug molecules, anti-cancer, not only cancer molecules, it can act even the oncolytic viruses to release specific to the cancer cells. And third most important, stem cells can be disseminated. Once disseminated in the solid tumor, they can migrate to distant metastasis also. Never forget, when the tumor is forming, the cancer cell doesn't go in the metastasis. What goes in the metastasis is the cancer stem cell. It sleeps outside the primary tumor, even if it is when it is a microscopic size. It leaves from there and travels to the normal tissue and starts a hibernating place where it can start a new tumor formation. The markers like death receptors present on angiogenic blood vessels and EGFR markers are the basic things which act to localize the cancer cells by stem cells, which are going to act as a delivery vehicle to deliver the anti-cancer drugs or oncolytic viruses. This is the conventional method. What we do is that we try to treat the cancer by radiation, chemo, whatever the best of molecules that come, but none of them can cure the attack on the cancer stem cell. The cancer stem cell remains in a microscopic way and it comes as a recurrence, as a metastasis. This is very important to show one slide, how the combination of traditional methods or conventional methods like chemotherapy or radiotherapy can be used to treat along with immunotherapy to eradicate the cancer. The radio and chemotherapy do sensitize the cancer stem cells to immunotherapies, particularly natural killer cells. First, what we have to do is use the cytotoxic therapy. Once we use the cytotoxic therapy, the major cancer cells will die away. What remains are the sensitized cancer stem cells, which can be attacked by natural killers or dendritic vaccines. Normally, we have a source of stem cells like autologous, allogenic, synergic, iPSCs. I need not elaborate this here because we are lacking of the time. This is a slide which shows you how a stem cell tracks down the cancer stem cell. It tracks down to even metastasis as well as the primary tumors. Particularly, this slide I want to show you for one reason. You may track down the cancer cells rest of the body, but you cannot reach to the brain because 98% of the drugs cannot cross the blood-brain barrier to reach to the cancer. Thereby, stem cell plays a major role to reach to the secondaries or primaries of the brain. It is being studied, lung, liver, ovary, bones, all other metastases, not only brain, where the track down of the stem cells can be done for the cancer stem cells. As I said you, it is a delivery vehicle. Stem cells can be modified with multiple anti-cancer agents, potential application for invasive and metastatic. These are the delivery one. Pro-drugs can be used for delivery one, which can be apoptic, fast ligaments can be used, antiangiogenic factors can be used, oncolytic cancer viruses can be used to release at the site of cancer. Now, how it is done? A stem cell is modified in a lab. It takes at least 3 to 4 weeks to have an enzyme, CD, an example enzyme which I have given. The dose of stem cell is already given intravenous to the patient. Then we give inactive prodrug like 5-FU can be given. This inactive molecule, once it reaches to the stem cell, it enters the stem cell. The enzyme in the cell activates that drug and releases on the cancer stem cells. And it has got the tropic action towards reaching the cancers. This is a slide which can show you how it can reach. It will eliminate the cancer. This is a video which will show you how it is done.
But individual tumor cells may have already spread to normal brain tissue. relapse almost always occurs, usually resulting in death. With Dr. Aboudi's research, neural stem cells are modified with genes that express therapeutic enzymes. When these modified cells are injected into the patient, they migrate through tissue and seek out the tumor sites. Then a prodrug, a benign form of a drug, is injected into the vein of the patient. When it reaches the brain and encounters the enzyme produced by the modified neural stem cells, it is converted into a chemotherapeutic agent that fights the tumor. In effect, it achieves localized chemotherapy production, specifically at the tumor sites. That is the hope.